Are you recently diagnosed with rheumatoid arthritis, or are you in the process of an RA workup? Do you have joint pain, swelling, stiffness, and feel lost right now? It can be scary to receive a new diagnosis of rheumatoid arthritis. You might see several different doctors before getting the right diagnosis and treatment. I know this can be overwhelming, but you're not alone. RA affect 1.5 million people in the US. In 2025, RA is a very manageable disease. Today, I will share some easy to understand insights for anyone who is new to this diagnosis. Hello, my name is Dr. I'm a board certified rheumatologist who practices integrative medicine in Hawaii. I'm also a clinical professor who trains resident doctors. So, what is RA? Rheumatoid arthritis, RA, is one of the most common autoimmune diseases affecting about 1% of the US population. Your immune system's original roles are number one, protect you from infections, and two, find and destroy young cancer cells. But sometimes it can get confused and angry and start attacking our own body. That's the definition of an autoimmune disease. For symptoms, people with RA often experience joint pain, swelling, and morning stiffness. The most commonly affected joints are in the fingers, wrist, and feet. In the fingers, RA typically affect the knuckles, MCP joints, and the middle joints, PIP joint, sparing the furthest joints, DIP joints. People also commonly have RA involvement in the MTP joints and toes of the feet. As RA progresses, it may also affect knees, ankles, shoulders, elbows, and your TMJ. When your immune cells infiltrate the joint space, they cause inflammation and fluid buildup, which lead to pain. Morning stiffness can last longer than an hour because you are not moving while you're sleeping, so fluid stays in your joint overnight. Sometimes a hot shower or soaking your hands in warm water in the morning helps loosen things up in the morning. Because RA is a systemic inflammatory disease, people may also feel fatigued all the time. In rare cases, RA can affect the lungs, causing interstitial lung disease. It's called ILD. In short, symptoms of ILD include shortness of breath, dry cough, fatigue, and weakness. RA can also rarely affect the eyes, leading to inflammation called uveitis. Signs of uveitis include redness, eye pain, light sensitivity, blurry vision, floaters, or change in vision that does not go away. If you notice these symptoms, let your doctor know so that they can guide you appropriately. What to expect in the first few months? To confirm a diagnosis, you will see a rheumatologist for labs, imaging studies, and physical exam. Lab tests often includes ESR and CRP, which are inflammation markers, along with rheumatoid factor and CCP antibodies, which are autoantibodies. Although some people with RA do not have these autoantibodies, basically these are antibodies against your own cells, those people with rheumatoid factor or CCP antibody tend to experience more active disease. Imaging, like X-ray, shows if there's any damage from inflammation. Long-term active RA can cause joint space narrowing and erosions in the joint. If erosions are present, more aggressive treatment may be recommended to you. What can you do starting today? Besides seeing a rheumatologist, it helps you to know some well-established risk factors and reverse them. A typical Western diet high in refined sugar and ultra-processed food fuels chronic inflammation. Studies on red meat consumption show no clear link to developing RA, but among those people who already have RA, limiting red meat can lead to better outcomes. Regarding the big picture in diet, this is what I tell my patients. I tell them, imagine a plate in front of you, and 70% of your plate should be filled with vegetable because the pigmentation in veggies contain phytochemicals. This is good chemical. It cools down inflammation. You should consider vegetable as your main entree and protein starch as side dishes. The main thing about anti-inflammatory diet is it's a plant-rich diet. Stay well hydrated with clean water. start around 60 ounces a day and try to cut down on coffee, which dehydrate you. I have seen many patients who drink one venti-sized coffee throughout the day. If you have to drink coffee, limit your coffee to one tall size a day, or consider decaf, which actually contains 10% of caffeine compared to the regular coffee. Right now, your body is saying, help me, I'm tired. Give her the rest and nutrients she needs, not more coffee. Remove ultra-processed meat like Spam from diet. I know I live in Hawaii, but Spam's gotta go. Also avoid refined sugar like soda or bottled fruit juice and artificial sweetener. Diet Coke, Coke Zero, they're not okay. Start reading labels. Avoid refined sugar, added sugar. Fresh fruit also has anti-inflammatory property. If you want fruit flavor, eat real fruit, not bottled orange juice on the shelf. Organic, in terms of fruit and veggie, they are even better. Stress is a big trigger for RA. In functional medicine, we often see how stressful life events align with RA flares. For example, a loved one's hospitalization or a major life change like divorce can trigger a flare. It looks like this. Mom gets hospitalized in ICU. The patient gets super stressed and reaches a diagnosis RA. Years later, she goes through legal battle during divorce and has another flare. 5 years later, her support dog passes away, another flare. When you're afraid or stressed, your body releases stress hormone cortisol and inflammatory signaling molecule like TNF and IL-6. These are the exact targets of some RA medications like Humira, Enbrel, Actemra. If you smoke, now is the perfect time to quit. Tobacco is a major risk factor for RA. During stressful periods, your body craves comfort food, high in sugar and calories causing weight gain. Elevated stress hormone cortisol from emotional stress can also contribute to weight gain through insulin resistance. Extra fat tissues in the body release even more inflammatory chemicals, making it worse. This is a vicious cycle. When the body secretes too much inflammatory chemical like this, a medication like Humira doesn't work as well. RA is a very lifestyle-dependent and stress-dependent disease. Try to focus on plant-rich diet and gentle exercise like walking, even if your joint feels sore. Exercise is actually helpful. Talking to a therapist can also help you reframe your struggle and reduce stress. Over time, mind-body exercise such as yoga, tai chi, or qigong, and meditation can be helpful. Acupuncture can also support better sleep, reduce stress, and ease pain, but start with healthy diet and therapy first. So today, we discussed about what to expect after a new RA diagnosis. I understand this can be a frightening time for you, but please remember, you're not alone. There are 1.5 million people out there in the US. I made this video because so often people walk into my office in so much fear, extreme fear about this disease. Their biggest fear is, am I going to live like this forever? For most people, the answer is no. Of course, you will need to take right course of action from now on, but effective treatments are available combining both medications and lifestyle changes. I'm trained in traditional Chinese medicine, TCM. In TCM, they believe most chronic diseases are caused by emotional and spiritual trauma. The body keeps score. So just like we discussed, your mind was likely hit by some sort of emotional trauma, and your body's releasing the trauma through physical symptoms of RA. According to Chinese medicine, symptoms are not bad. They're basically releasing the trauma in emotion and spirit for you. You might still be experiencing emotional trauma if you're going through tough event like divorce that's not happening in the most loving way. Connect with people you love and consider seeing a therapist who can help you work through some emotional trauma. Don't try to power through this alone. Despite tough times, find more ways to connect with love within you, not fear. In your lifetime, you probably overcome something bigger than RA, whether in school, career, or relationships. What did you do when you're going through the biggest challenge of your life? You learned, like you're doing right now. You got help, you'll see a rheumatologist, and you pushed forward, didn't you? And on the other side of pain, you grew. It's the same thing for RA. It's not cancer. Don't let your RA diagnosis become another source of emotional and spiritual trauma. Instead, this might be a good time for you to take a deep breath, rearrange your life, and become wiser, stronger version of yourself. Reading books and going to seminars can also accelerate your growth. Also, after talking to your rheumatologist, if you decide to go on medication, please don't read every single possible side effect online and implant the possibility of those side effects happening to you. You've heard of the placebo effect. Even among people who took sugar pills in the clinical trials, substantial amount of people, like 30 to 40%, experience clinical benefit in some studies. With sugar pills, your mind is very powerful. It manifests whatever you focus on. It's like a wizard. When you stay stressed and when you stay in fight or flight mode for a long period of time, it fuels inflammation. If you're going to take medication anyway, approach it with positive intention. Instead of thinking, this medicine has so many side effects and I'm afraid it's going to hurt me. Instead of that, try affirmation like, this medicine will only have positive effect on my body and I'm grateful for the healing. For many patients, I consider RA medication a band-aid. They help prevent RA from destroying our joints while you optimize your lifestyle and learn better stress management tools and heal from emotional trauma. Here's a chart showing some of the patients I helped over 1 year. As you can see, many achieved remission. Some quit smoking, others lost weight, and some even stopped their medication after reaching remission. They healed not just physically, but also mentally. I ask my patient to read books on psychology and meditation. I give them homework because I want to help them live life in a way that serves their highest purpose. Many people on this journey learn that no matter what challenges happen in life, no matter what some people say, they are enough and they are lovable. They develop stronger sense of self-worth. With the right medical care and lifestyle adjustment, most people with RA do very well. Please make sure you get appropriate evaluation and help with your physician. I wish you healing, peace, and strength on your journey. Thank you.